This is a CJSN podcast. My name is Sumida, and I'm a nephrologist and faculty member in the Division of Nephrology at the University of Tennessee Health Science Center. On behalf of my co-authors, I'm excited to share the results of a team's recent study entitled Comparative Effectiveness of Lubiprostone and Stool Softeners on Risk of Kidney Outcomes in Patients with Chronic Kidney Disease, published in CJSN. Lubiprostone, a chloride channel activator used to treat constipation, has been suggested to exert kidney protective effects by improving the gut microbiome. However, little is known about the comparative effectiveness of lubiprostone versus conventional laxatives on the risk of kidney outcomes in patients with CKD. Among U.S. veterans with CKD and constipation receiving care from the Veterans Administration healthcare system between 2004 and 2019, we conducted a comparative effectiveness study to examine the risk of kidney outcomes associated with instant or new use of lubiprostone in comparison to that of stool softeners using a target trial emulation approach. Among more than 52,000 eligible patients, 1% were new users of lubiprostone, while 99% were new users of stool softeners. The majority of the patients were male, with a mean age of 73 years. The mean eGFR was 51. The baseline characteristics were similar between instant lubiprostone and stool softener users after propensity score overlap weighting. We found that, compared with instant stool softener users, instant lubiprostone users had significantly lower risk of a composite kidney outcome and lower risk of experiencing more progressive eGFR decline. The association was generally consistent in several sensitivity analyses accounting for prescription year, restricted mean survival time, medication adherence, and competing risk for death, with the negative control outcome analysis showing a non-significant association. In summary, in this real-world analysis comparing laxative therapies in U.S. veterans with CKD and constipation, instant lubiprostone use was independently associated with a lower risk of progressive kidney function decline when compared with instant stool softener use. Further in-depth studies, including clinical trials, are needed to determine the mechanisms underlying potential kidney protective benefits of lubiprostone and to refine the comparative effectiveness across different types of laxatives on kidney outcomes in patients with CKD. Thank you for listening.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.